What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive for COVID, or maybe had to take a test for something else and you tested positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Virus Update for Friday, January 24th, 2025. If you are new to my channel, welcome to my channel. You just clicked onto the channel that gives you updates on all the viruses that can make you sick. Let's face it, now more than ever, you need updates on these viruses. It's getting harder to find information, news, and data. I try and find whatever I can find each and every day, compile it into a web browser, and then present it to you so you are informed with what's going on. I mean, H5N1, there's been a lot of news for that lately. All the other viruses, there's been a lot of news. A lot of people are sick right now. A lot of people can raise their hand and say they know someone who is sick right now. And that is a problem. I get it. It's the winter season for viruses. But last year proved we had a summer season as well when it came to COVID. And, well, H5N1, we don't know what that's going to do down the line. It is really becoming a problem with shortages in eggs. A lot of poultry animals have had to be killed. There's been dairy outbreaks. The road for that ahead remains very uncertain, and well, we can only hope, knock on wood, it does not go human to human, but we don't know. So you need to be informed with what's going on. Want to do that? Just subscribe to my channel down below. We're trying to hit 10,000 subscribers this year. The more people I keep informed, the more people I can help keep safe from all these viruses. Give this a thumbs up if you like today's video. We're going to try for 200 like button hits today. We fell a little bit short yesterday. I think we can do it again today. And share this video with anyone you know. Leave your comments down below, and don't forget to hit that notification bell. Alrighty, we have a ton of news stories for you today. And yes, we actually do have some CDC data today. That is a surprise. I was not expecting anything from the CDC today because of the new directive that they were given, but hey, they did update some things, so that's great. And then we have some of our daily stuff, which we are going to take a look at as well. And note, this may be the most news stories we've ever showed in one video, or most things in the news segment. Yesterday I said that, but today may come close as well, because there are 3 things I have to show you on the website today, all in the same thread, and it's in relation to one of the viruses. You'll see that in a little bit. All right, starting off with bird flu. Luckily, I think we only have one bird flu story today. At least there's that for some good news. Bird flu case confirmed in domestic cat in New Orleans. I could have sworn we heard about this earlier, but it's going on here saying the cat was collected on January 7th and diagnosed with bird flu on January 14th. I guess now they're just now saying that it's confirmed to be H5N1 bird flu, because if you go down here, it does talk about H5N1. All right, moving on to this. School health officials report surge in illness in Iowa. Yes, Iowa is no stranger to outbreaks, because a lot of places are having outbreaks. Oklahoma's been getting hit really hard. We actually have a story on Oklahoma today. It says here, number of schools reporting 10% illness this week. And that is 73 schools. So that means 10% of the school body, the population of the school, is reporting an illness. And that's quite a few. Moving on to this. In long COVID news, there is this that came out yesterday. Analysis showing significant financial burden of long COVID in the U.S. The only thing it is really doing is showing us some numbers, showing us some statistics, and confirming something we already knew was happening. Let's just read a little bit here. Managing long COVID cases could cost U.S. employers $1.99 billion, almost $2 billion, to almost $6.5 billion annually, according to a new model published yesterday in the Journal of Infectious Diseases. The model estimates current and future financial burdens related to long COVID, which affects an estimated 44.7 million to 48 million Americans. That's a lot of people. America's just one country. Imagine what's happening in India, China, the UK, all these other countries, Australia. Put it all together, we're talking a ton of people dealing with long COVID. We're talking a lot of dollars. This is a huge amount of money. Why would we not want to invest into trying to solve this problem, trying to prevent long COVID? Because I got news for you. People say, oh, well, this wave's not going to do that bad. That's not going to be bad. Okay. Each and every wave of COVID we have, there are new people going on to develop long COVID. Even when we're in between waves, there are still cases of COVID happening. There's still at least some people going on to develop long COVID. I can raise my hand for long COVID, not just from 2020, but from now as well. I mean, my infection was back in my most recent infection. Started back at the end of last year in December. Then I rebounded. And, well, to this day, I still have reoccurring issues that just pop up whenever they want to. Some of them popped up this morning. The point is, this is a real big problem, and it needs to continue. And look at this. It also says, since the SARS-CoV-2 virus is expected to continue circulating throughout the U.S., the number of people suffering from long COVID will continue to grow with each passing year. Yeah, we need to do something about it. Let me tell you something. Long COVID is no fun. And for me, with this most current bout of it, my original bout from 2020, it did in some way improve. I mean, I started getting injections for asthma. That helped me. But now that I'm back to phase 1 again, the headaches, these headaches are just absolutely ridiculous. And mine came back it was gone for a couple days. And then today it's like, hi, today's going to be headache day. I woke up congested. And then I had around 11:30 this morning, all of a sudden, like, why am I getting cold? And I looked at my thermometer in my room, like, okay, it's not cold in here, but I'll put another layer on. And you can see here, I'm wearing 2 layers today. Earlier, I had the space heater going in here. Yeah, these symptoms, they can come at random. And long COVID, it is a big problem. We really need to address it. All right, moving on. We have so many more things to talk about. I could go on the long COVID subject for hours, because it is just that important. Illinois coach Brad Underwood addresses illness woes versus Maryland. And this is for basketball. And apparently they are facing an illness outbreak that really impacted them. And it says here, we've been really sick, so we had some really disjointed practices, Underwood said Thursday during the Illinois pregame radio broadcast. And I get it. You don't want to have to forfeit a game. They didn't, but I'll tell you what, these are going to have, these people, not just this particular outbreak, any sports person in general that is continuing to go on while they are clearly sick with colds, flu, noroviruses, type of illnesses, GI illnesses, COVID, all these different things, long COVID, they're going to suffer consequences, whether it be in the short term, midterm, or long term later in life. It is not healthy to be continuing to play sports while you are sick. We are seeing it in the tennis world. There are several tennis players that are clearly having long-term issues, whether they had COVID or whether they had something else. They are just not playing right. Some of the best tennis players in the world are going on to deal with issues, and it is clearly showing up. There was one the other day I was told was using an inhaler in between rounds of a match of tennis. I mean, come on. If you're sick, do not overwork your body. Rest, rest, rest. All right. In Western Australia, this is from Dennis the COVID guy. Weekly COVID update from January 13th to the 19th, 2025. The COVID positivity rate is 6.1%. That's down by 2.1%. PCR cases, 252. That's down by 11.2%. Hospitalized average 98 per day. That's down by 16.9%. ICU, 7-day average increase to 6. That actually went up by 100%. Maybe they just weren't reporting it before. I don't know. Central Public Schools. This is in Oklahoma. Central Public Schools shift to virtual learning amid rising student illness rate. And I believe this is just for Friday. Then you get the weekend off, and then Monday, well, hopefully everything will be better and we can be back to normal. It's crazy. And my question for this is, if you're one of the people that are not going to go in because you're sick, are you still required to show up for virtual learning, or will you be marked out? How's that going to work? It's just totally ridiculous. I think if you don't attend it because you're sick, you shouldn't be counted as absent. It's not your fault that you're sick. It's the incompetence of no clean air, no masking policy. I know. Some will say, well, mask doesn't work. Okay, go to my site, datareport.info. Go down to the studies archives and click on masking. There's a whole bunch of studies there that will say, you're wrong. Masking does work. But, yeah, according to the district, this is due to elevated levels of student illness. The schools will be deep cleaned and sanitized so that students can return on Monday. We'll see. I mean, it takes more than 3 days for some people to get better. When I had COVID recently and a mystery virus before that, a month, and hell, I'm still not 100%. Some days I'm close to 100%. Some days I'm 65 to 70%, like today. I'll say closer to 65%. Flu deaths in North Carolina reach 50. And, yeah, they just continue to go up. But get this, more than half the deaths this season are people 65, ages of 65 or older. 50 to 64-year-olds adults range second, while, this is the part that you should take note of, while 3 people between ages 25 and 49 have died as well. Yes, that's interesting to report. Last flu season, there were 319 deaths associated with flu compared to 196 the year before, probably meaning 2023. Will they hit 319 again this year? Well, more on that in a little bit. They could. And there's a reason for that. Flu activity in the United States is not dropping yet. I'll show you that in a little bit. Speaking of flu, I was wrong, by the way, when I said we only had one thing for bird flu today. There was a second thing. It's this. I forgot about it. Health advisory. This is in Minnesota. Health advisory, avian influenza H5N1 testing in hospitalized patients. They are strongly urging, we're not going to read this all to you, but what you need to know is they are strongly urging hospitals, when someone tests positive and is admitted for, flu type A or whatever it is, mainly influenza A, they are strongly urging that they go and check for the subtype. Meaning, is it bird flu H5N1, something else? We want to find out. And we need to be doing this all across the country. It is time. I mean, anyone who is positive for influenza in the hospital or not, I think we need to find out what the subtype is. And I get it. That's costly. It's expensive. It's timely. But you know what? It just needs to be done because it is something that is just becoming such a serious issue. 10 measles cases confirmed in southwestern Ontario as public health units warn of possible exposures. And I do believe, was it last week or so we talked about Ontario? The point is it's now up to 10 cases there. I do not have a international tracking thread going on the site because I have so many other tracking threads. I just can't keep up with them all sometimes, so that would be too much. But I imagine once the winter ends, it's going to get a little easier to keep up with these tracking threads. But I haven't started an international one. We do have a U.S. one on the site. I don't know. Maybe we should do an international tracking thread. Kansas, tuberculosis outbreak is now America's largest in recorded history. Just saw this afternoon, and it says, as of January 17th, public health officials reported that they had documented 66 active cases and 79 latent infections in Kansas City, Kansas metro area since 2024. Oh boy. Yep, that is quite a few cases. That is rather concerning. All right, 3 things in the chronic wasting disease thread that I added today. Georgia has confirmed its first case of chronic wasting disease in deer. Iowa has 2 additional cases of chronic wasting disease reported in southwest Iowa. And Wisconsin study shows chronic wasting disease greatly reduces annual survival rates in deer, suppresses population growth. That's coming from Outdoor News. The other one was from KMA Land, and the first story came from Fox 5 Atlanta. If you Google search chronic wasting disease, you're going to see a ton of news stories popping up for that case in Georgia. That is concerning. That is showing up in Georgia. Not a good thing whatsoever. All right, moving on to this now from the Iowa COVID tracker. And I was given this data earlier. This is fantastic stuff that they do here on this map. And take a look here. This is influenza-like activity or SARS-CoV epidemic growth likelihood by state. And take a look at this. We're actually starting to see some growth pop up in the south. Look at this. We can see in Florida things are starting to grow once again. We can see in North Carolina, it's listed as growing once again. It's also likely growing in Texas at this time. And look at that. Even California at this time is coming up, likely growing in these oranges and the reds. That's not a good thing. What is a good thing is these states that are in green. Those are the ones that are declining. And some of the ones that are in yellow are not changing at this time. Look at this. New York State likely growing. We did have that little period where New York State cases were rising once again, and I'm going to show you New York State today. Sneak preview. New York State's not dropping, or at least not very much. You'll see that in a little bit. Even Pennsylvania is listed at likely growing. So we still have a lot of places that are dealing with problems at this time. Moving on now to this from Sci-Fi. He did a little bit of a thread earlier on some of the new CDC data that did, in fact, update today. The CDC reports COVID is rising in 9 states, echoing the Walgreens report on Monday. Also what CJS has been telling us about lately. The CDC reports flu positivity of 25%. 25%. A new season high and the 14th consecutive increase. So yes, level of influenza-like illness activity. You can see here New Jersey is very high. New Hampshire is very high. Wisconsin is very high. And it's still high in a lot of other states at this time as well. And we can see here, take a look at this. Emergency department visits when it comes to influenza. Yes, they have gone up once again. Not a good thing to see. COVID and RSV have dropped at this time. So that is okay to see. Taking a look here, COVID positivity rate by region. And we can see here that, yeah, it's not doing good at this point. The positivity rates are still rising in a ton of areas, or in several areas. And then it's bad news to see New Jersey and Wisconsin deteriorate to the highest category, which uses very high baselines. Yeah, not good. And we saw yesterday New Jersey hospitals were doing really bad. Last check earlier, they're not as bad today, but we'll see in a little. That data was from Sci-Fi. All right, moving on to Canada now. Take a look at some more CDC data in just a little bit. Canada, the COVID viral activity level is moderate. Flu A is high. Flu B is moderate. RSV is high at this time. We'll do another recap of the UK again over the weekend. Quickly taking a look at air qualities here, because I just realized this video is really going long today because we got so many more things to take a look at. And can we do air qualities? Let's see. Well, the point is the West Coast is still bad for air quality, and the East Coast does have some spotty locations. That's why, yeah, you can see it here. And even places like Minnesota, Iowa, yeah, you have some yellows showing up today as well. In Pinellas County, Florida, there are some calls right now. We do see 4 calls for sick person at this time, and a few other things going on. Philadelphia had 782 EMS incidents yesterday. Have not been listening to EMS activity much lately. Maybe I will later today, because I do have a project that I'm going to be working on. I'll explain that in a little bit. Everything's in a little bit. Taking a look here. Wow, Montgomery County is really busy. Total EMS calls, 19 at this time. That's quite a few. And I got a feeling Chester County. Okay, not as bad as it was earlier. When I was clicking on it, the preview was showing what I saw earlier. I'm going, oh no. Earlier they had like 15 or 16 calls all at once, but not bad right now. Moving on to hospitalization or hospital status in Pennsylvania. And we can see, yes, there's a lot of hospitals right now in the yellow, which indicates that there is definitely issues going on and high volumes of patients still. Let's see what's going on in New Jersey. Hopefully some good news here. And take a look at this. So far, yes. 1, 2, just 2 hospitals today dealing with patient volume problems. And that is much better than yesterday, which did peak at 15. Princeton, yet again, Princeton's constantly having emergency divert problems. That is really patient volume problems. That is really just continuing to be an ongoing issue there. Walgreens this week, 12.3% COVID positivity rate. All right, let's pause for a hydration break real quickly. Always very important to keep yourself hydrated. Alrighty, I do want to show you 2 things. And you're going to see 2 different things. First off, The CDC wastewater page, at least this one that shows the trend charts, and I can guess I can go state by state, which I didn't actually dig into that. We'll do that over the weekend. Actually shows the majority of the country is dropping. However, take a look at this purplish color here, south. That's the south region. Yeah, that had a rise this week. We'll have to keep an eye on that. Could that be short term? Could it be multi-week? One of the reasons for that is because of the fact that it is oh so cold. They had some snow in the south, so it's keeping more people indoors, which does lead to more transmission. At the same time, we're going to take a look at the south here on wastewater scan. You see something completely different. It's dropping. Wastewater scan showing something different from the rise that we're starting to see from the CDC again. So discrepancies in the data. It's nothing new. It's happened before. Influenza A just continues to rise in the south at this time. Norovirus may have peaked. That may be dropping at this time. We'll take a look at the rest of the regions and even some individual wastewater sites over the weekend. If not tomorrow, definitely on Sunday. Who knows what tomorrow will be like when it comes to news. No update in the variant this week. XEC is still the leading variant at 47%. And let's just end today on New York State. Today, yeah, this is not good news. You can see here on this chart, it's not really going down. 1,450 positives, which is actually higher than yesterday, which happens once in a rare while on Fridays, and usually not a good thing when it does. Maybe yesterday there was some cases not reported that got added in today. Whatever the case may be, it's making this average chart show that it's not going down. And waves that take longer to go down, you know what? They're actually riskier. And you're probably thinking, well, I mean, if it takes longer to go down, but it's not up as high. And here's the deal. The longer a wave is taking to drop, the more chances are of you getting infected. The more chances are of you going on to get long COVID, hospitalized, or God forbid someone should die of COVID, which is still definitely a thing. It means that the period of high risk is just persisting for a longer period of time. I mean, we're ever so slowly dropping, but we're not really dropping. I mean, look at the end of the summer wave. You can see it really started to go down fast. Right now, at the moment, that's not happening in New York. We like to hope that that pace would eventually pick up going on down the line. All right, finally today, we do have hospitalizations for New York State. 866 and 84 people in the ICU. We'll take a look at LA tomorrow. We'll take a look at California tomorrow. I'm going to make notes to do that. And anything else we may have missed that updates on a Friday, we will get to it tomorrow. That does it for today's virus update. But before I end, something I do want to comment on. I've been getting some comments about backing up the website and backing up the virus updates. First off, backing up the virus updates, yes, that I can do. And believe it or not, I think I do have the majority, maybe not the out in the wild ones. Oh, no, actually, I think I have them as well. I do have the majority of them saved. I just have to move them over from this computer over to an external drive and organize that. And that I think I am going to do. As for backing up the website, that's a bit more of a complicated task. We use a forum website, which comes off of a host. I can get it for a X amount. I can get it all saved into a file, apparently. But I cannot actually just physically download the whole contents of the website somehow. That's a problem. So for as long as the forum site's around, which I assume it's not going away anytime soon, there's no plans for it to, my website will always be up there. So, yep, for as long as that lasts, it will be up there. So, yes, these virus updates will be backed up just in case, for whatever reason, they do ever get lost. Alrighty, if you enjoyed this update, give it a thumbs up. Hit that subscribe button down below. Hit the notification bell. Share this video with anyone you know. And, of course, leave your comments down below. I'm sure something from this will spark a comment today. I will see you all again tomorrow. Until I see you again tomorrow, have a fantastic Friday and a fantastic weekend. Stay safe, everyone, and thanks for watching.